welcome all to the first of a series of webinars that are being held topic specific in follow-up to the 2023 Health Equity Summit from last fall. Each of the webinars will be hosted by different partners on health equity topics that were identified by attendees of the summit as keys to success. I failed to introduce myself. My name is Nadine Hagmeyer. I am, as a number of you on the attendee list know and recognize my name from KFMC Health Improvement Partners. I've been around for some time, and today I do have to give you all the caveat that as of yesterday at like 5 something, I was thrown the ball to pinch hit for Tammy Elliott, who has an opportunity today to sit and be part of our civic duty called jury duty. So she tossed the ball to me late yesterday and asked if I would step in. So just so you know, many of you know I'm good at winging it and going with the flow. Well, that's exactly what I'm doing today. And I wanted to share that with you so you can have grace and forgive me if I screw something up as we go through. But welcome to the call today. For this event today, we have partnered with the Kansas Office of Primary Care and Rural Health, which is a part of KDHE. And as part of the initiative, you can go ahead and go to the next slide. We have a group of partners, and you can see them here on the slide. And that group of partners are the people who have been at the table to put together the content for the annual Health Equity Summits and the toolkit, which we think is a great collaborative effort on our part. But those partners are Blue Cross and Blue Shield of Kansas, Community Care Network of Kansas, Health Information Network of Kansas, the Kansas Health Institute, Kansas Healthcare Collaborative, the Hospital Association, as well as the Kansas Perinatal Quality Initiative or Collaborative. So welcome to everyone. And I'm going to turn it over to, as you go through, sorry, let me back up a little bit. As you go through, if you have any questions or thoughts that you want to pop into the chat, in addition to putting in your name and where you're from or your organization that you're representing today, please do so. We will be monitoring the chat as we go through the webinar today. So Luca, I'm going to turn it over to you.
Thank you very much for that introduction, Nadine. So my name is Luca Petri. I'm a research analyst here at the Kansas Department of Health and Environment. And the Office of Primary Care and Rural Health is very excited to be the first co-host for this webinar series. So as we get started today, I would like to ask everyone a question. And you don't have to answer out loud, but how many of us have been poor? Because there's a feeling in your gut that happens when you know the answer to that question. And I want you to consider that answer as you listen to today's presentations, because the presentation before you is about food insecurity. And in Kansas, we have a significant problem with food insecurity for our residents. Now, we define food insecurity as lacking enough access to healthy, quality food that gives you the ability to lead a healthy and active lifestyle. This can be associated with lots of things, whether it is unemployment, poverty, an unknown medical bill, a car repair. So many things can force people into a situation where they suffer from food insecurity. And until September of last year, I was among this population who suffered from food insecurity. That's hard. I work for the state. I have a good job. My wife also works. And until 6 months ago, this population included me. It affects everyone that we know. And the most vulnerable members of our society don't have a way to combat this issue. That's why we're here today. 291,000 Kansans suffer from food insecurity. That's 9.9% of our population. And roughly 92,000 of those people are children. Now, the average rate is about 10.4 here in America. And that means that we're only slightly better than average. But in all reality, Kansas is among the top 25% of those dealing with this crisis. We have some of the lowest numbers in the nation, and still 1/10 of our population deals with this issue. If we think about this from a statistical standpoint, this graph was provided to us by Kansas Health Matters. And in 2011, when this data was being tracked initially, 15.1% was a ghastly number. That's about 460,000 people for those of us who don't do statistics. Now, in 2018, there was a methodology change. Now, you'll notice that they've marked it here. So we went from 15.1 to 12.7, about a 2.5% difference. And that's something that we can be proud of, truly. But when we changed the methodology, we went from 12.7 down to 9.7. You'll see right here in 2020. And in 2021, when this data was adjusted, it went up to 9.9%. 0.2% doesn't feel like a lot, but that's 6,000 people. 6,000 people. For reference, most towns in Kansas don't have a population of 6,000 people. We are an agricultural state. We produce $14 billion worth of commodity exports in just the agricultural sector each year. We have more than 40 million acres of farmland, and we can't feed people. Kansas Food Bank created a list of information. And here at the Office of Primary Care and Rural Health, we have an ArcGIS mapper. She's in the audience today, and her name is Brittany Nasiri. And she's made this map for us with that information that they've provided. Now, this information is from 2021, and it was accurate as of when it was pulled back in November. But this map details how many participants from food banks qualify for SNAP. You see, the biggest hurdle to getting food assistance isn't access, it's pride. It's a mentality that we can't adjust unless we address it. It's something that we have to be willing to humble ourselves and understand that perspective. 66% in some areas, 66% of people who qualify for SNAP are not utilizing that service. This is food for thought. These numbers should make your heart break a little. 67% have to have free and reduced lunch. 38% used WIC. 43% using health services have diabetes or pre-diabetes. Food is not just one issue. We know that food impacts early childhood development. We know that access to quality nutrition can make or break chronic condition management. People who suffer from asthma or fibromyalgia or diabetes, they all suffer because of a lack of quality nutrition. Food deserts, they exist, but they exist because of a lack of access. And that access is primarily driven by the fact that we allow our most vulnerable members of our population to suffer in this manner. We don't humble ourselves. We don't understand their suffering. And if we did, if we began to talk to each other and to others about this issue, we could get that number down from 9.9% to 0. Continuing at our current rate will only lead to our destruction. And that is why we are very glad to see how many of you have signed up to continue this conversation with us. Now, I'd like to offer this one sentiment. The stories that you are about to hear from our presenters today are success stories, and they are tailored to each community. And what we need to understand is that in order for us to address this issue, each community must step up and address it. With that, I'd like to turn it back over to Nadine.
Thank you, Luca, for that very thought-provoking set of slides. I think most of us can relate to those slides. It is my pleasure to introduce the first success story, and we will hear from Deborah West, who is with the Providence Medical Center and Medical Group in Kansas City metro area. She is one of the corporate partners for Harvest Mobile Food Distribution in Wyandotte County. And Deb, if there's something in particular that you would like the viewers to hear about you and in specific as in the way of a bio, please do so as you start your presentation. Thank you. Welcome, Deb.
Thank you. Good morning. I've been with Providence for about 9 years now, and I'm the senior manager for primary care. So I have 6 locations between Wyandotte and Leavenworth counties. So if we want to go ahead to the next slide. Back in 2018, we started using these social determinants of health forms to start gathering data with our patients, our clients, to try to determine from them what they were needing our help with. We have care managers in our primary care clinics to try to help our patients determine what we could do to help them. We would ask questions as far as whether it was food, transportation, help with medications, help with utilities, housing, and those kind of things. And it became very clear that the number one thing was help with food. And then the second was transportation, getting patients to their doctor's appointments. And so we had a relationship with one of our payer groups, which was Humana, reach out to us and state, hey, would you be interested to partner with harvesters to get a food drive set up? And we're not the only one in Wyandotte County. There's many other places, that does a harvester's food drive, but they really reached out to us and said, would you be willing to start a food drive? And I was like, this sounds wonderful. Very willing to start something like this. This really tugged at my heartstrings and thought, let's do this. So we are talking back in 2018. And so we put together a team, pulled in my care managers and said, let's strategize and see what we can do to arrange this. So with this, you had to have, Providence is a for-profit. You needed to have a location that had a large enough space to drop a semi-truckload of food. And you needed to have a non-for-profit. And so let's start planning. So I tried to reach out to people. So with my contacts of who I had, I'm on the board at KCC. So I reached out to them and I talked to the Y as our non-for-profit. We had Humana and we had harvesters. So we started meeting and brainstorming and really started putting things together, and then bam, COVID hit. So we had to shut down all of the forward movement, forward momentum that we had going there, and just had to quit. And then after we got through that, we kept in touch. We kept emailing. We kept in touch, but we then reconvened about in March of 21, said, let's get this going again. KCC, their board approved everything because they had the big parking lot. They approved everything. And our first drive was June of 21. And we had volunteers all set up, everything. And our first drive was June of 21. And people showed up. That was kind of our first worry. Are people going to show up to help us because we want this to be successful? And we had put out flyers. We had put out things in the college. We had put out things in our offices and all of my primary care offices to let people know we're having a food drive. Please come get food. And we were praying that we're going to have all this food. Are people going to show up? What do we do if we don't have people come? And that's where we had the Y as kind of our backup because they had a food pantry. So they were kind of our backup in case we had food left over. So kicked it off. Next slide. This was kind of our motto. We decided to go with this. The way to get started is just quit talking and let's go for it. And that's what we did. We went for it. Next slide. And here's our partners. Whoops. Like I said before, we had the harvesters, Providence Medical Center, medical groups, and the medical groups, like I said, that's the clinics. And the clinics was the support and the kicker here. KCKCC, the YMCA, and Humana. And that was the 5 partners. Next slide. This shows the data that we gathered from when we started June of 21. And this goes to March of 23. I didn't get my most current data uploaded for this presentation. But this shows how we gathered our data. We gathered how many families we served. And then we broke it out by the adults in the family, the children, and the seniors. And then the pounds of food is what was dropped by harvesters. And that varied by what they sent to us each month. And it was important to keep this data to show who we were providing to each month. We just had a drive last Friday. So in January was the biggest drive we had. And we served 294 families, 548 adults, 449 children, 191 seniors, and we had 19,633 pounds of food. And that was our biggest drive yet. Next slide. This was just kind of a chart that showed how it has grown, just putting those numbers to a chart. And then this was our team, our original team. Danny from the Y didn't provide a picture, but this was our original team. Dr. David Knoll and Jackie Penner from KCKCC. But this is our original team of 5. Nathan Howard also from Harvesters. And these are some points that we learned from the beginning. You know, it just, all of us just from the beginning, how it felt physically and spiritually, how to help others. Everybody on our line with all of our volunteers, it was just so fulfilling to be out there, seeing the people come through our line. How hunger doesn't just, it's affects everybody. You see the kids in the car, you see grandparents in the car, how mom and dads are struggling just to take care of their families, and how we all wanted to be there to help everybody. How we realize that with the children, that sometimes it's the only meal that they might have are the ones that they're getting at school, and that's the only healthy meal they're receiving. So they are waiting for us sometimes to have that harvester's food line to come get the food that we're providing them. And that also, you know, hunger and affects people mentally and physically, and that they need that food to help them. It affects, you know, their diet and also their physical condition when they do not have appropriate food. This all began by collecting data on our SDOH forms, and that our payers helped us by starting that, by requiring that information, and that number one need was food. So our core team and volunteers that come and are so dedicated and compassionate by living out this mission with harvesters, we are helping all the people in our community. Just knowing that, you know, every family in our county of Wyandotte has this need, and we're trying to help them through harvesters, provide them with the food that they're needing. I presented this to our leadership at Providence Medical Group and solicited more of our leadership team to come help and volunteer. So that's what this was. Come volunteer, you won't regret it. Thank you. This was a picture that I did take of a little kid, a child in a car that had written a note just saying thank you to our volunteers as they went through our line. And that meant a lot.
Deb, I want to thank you for your sharing your journey and what it brought not only to assisting the people in your community, but also what it brings to those who volunteer and who are on the working end, the serving end of that work. That it is a fulfilling initiative. Thank you.
It is. We've been out there at temperatures of 18 degrees up to 110 degrees. So we are definitely dedicated when we're out there on the line.
Well, we appreciate you and we appreciate your team, and thank you for sharing your story.
Thank you.
It is my pleasure to announce our second speaker today. And our second speaker is Callie Brownlee, who is a registered dietitian with Konza Prairie Community Health Center. And she's here to share with us the success of the food prescription program that's been established in Geary County. Welcome, Callie.
Hello, and I realized since making this presentation, the year has changed as well as my last name. So kind of, if anything is 2023, just know it's 2024 now. Again, I'm Callie. I'm a registered dietitian. I work on the clinical and WIC side at Konza Prairie Community Health Center. As well, I am a board member of Live Well Geary County and run our local farmers market. That all kind of ties into this healthy food prescription that started in July of 2022 when Live Well Geary County received a Pathways to a Healthy Kansas grant from Blue Cross Blue Shield. And we piloted that with Konza Prairie Community Health Center, starting with policies. What was that going to look like? For how does it work? Where are people going to get the food and use those coupons? So we started that with Konza, and then we opened up using these prescriptions at the farmers market. And over the last 9 months, we have also been able to open up providers to serving our local hospital and starting partnership with the health department. So next slide. All right, and this is kind of a little bit about our program steps. We knew the goal of our program was going to be using healthcare provider influence and the prescription writing to increase the kind of compliance of eating fruits and vegetables to help with nutrition related concerns that we have in our community. For diagnosis, we have, this has to be from a provider. We have prediabetes, diabetes, weight management, hypertension, and we do screen for food insecurity for that. So they would be eligible for the prescription from their provider. Let's see. We know that with kind of the medical diagnosis, we as dietitians know education is important, helping with access. So as dietitians, we kind of take over that education and referral portion for the programs, getting connected. And then shopping. Shopping was a big thing as well. We saw as a challenge. We currently have 2 farmers markets in our community, but those are not all year round where you can purchase the fruits and vegetables. So here at Konza, we opened a food site. So Live Well Geary County purchased a freezer to have fruits and vegetables in, as well as canned goods, because here at the kind of healthcare center, we couldn't keep the fresh things on the shelf for long as the program was just starting. So we bought that freezer for people to have access at any time to fruits and vegetables. Let's see, I think that was all about our kind of program steps. So next slide. And then this is kind of an example of what the participants would be getting. They get that food prescription with general nutrition education from their healthcare providers, telling them kind of how much fruits and vegetables they should be getting, and they are able to go to their food site to redeem those for the coupons that you see over there, worth $5. They are eligible for up to $25 or $50 for participating in the program, and the education they receive from our registered dietitians is free to them. They can do those in person, over the phone, texting. We do allow that, but we know it's hard to kind of communicate back and forth by text message. So phone calls work the best, I've seen, with our participants. And then we do, at our food site here at Kanza, we partner with the Kansas Food Bank to get some of those canned and fresh fruits and vegetables for our participants. And then currently, we are not in any of our local grocers. This is a goal that we have to get into the Aldi's, the Walmart, the Dillons that we have local here in Junction City. We've gotten advice from kind of the local managers to take this to corporate. Corporate's going to be the best people to communicate with. So we are just in the process of building that relationship to hopefully get into places that people are currently shopping. For that, I think we can go to the next slide. And this is kind of what our outcomes have been over the past almost 2 years. The number of people who have received the $25 is 118. The number of people who have received the full $50 is 70. We know that our redemption rates aren't as high, and after evaluations, feel like when we get into local grocers, we're going to see a better redemption rate. When they're here at our medical office, they are going to spend, and then they maybe don't come back for 2-3 months. So depending on how they visit their medical office. So getting into those local grocers is definitely our goal, to get them better access to fruits and vegetables, or participants. Sorry, I feel like that was super fast. That is my last slide about the program. Yes.
Thank you very much for that, Callie. It is great to hear about opportunities like this coming from other partners in attendance today at Blue Cross and Blue Shield to make opportunities like this possible. So fantastic presentation, and I look forward to seeing more things like this crop up in the future. You guys are setting a fantastic example. All right, for our last presenter of the webinar, I would like to introduce Kareem Schneider. She works over at the Genesis Family Health down in Ford County, and they have one of the best food security rates per population here in the state of Kansas. So we'd love to hear more about how they have succeeded in this mission.
Hello. All right. Thank you, Luca. Okay, I'm Kareem Acosta Schneider. I'm a community health worker supervisor here in Ford County. And my other co-worker is Cecilia Holguin, and she's part of this this wonderful successful story we have here. Could you please next slide, please? Well, we're a community health worker here in Ford County. We really have a great role in our community. We love to help vulnerable families and preventing hunger in the community. We help to find and get resources to care, manage, and care transition, because we are the facility, the communication between healthcare and other organizations. Next, please. How this is possible? Well, this is possible because we have a great communication and community leaders. So we participate in different boards here in city, so we can express our concerns, why we are here to work for them, the most in needs. This is happens. So it's other organization we prioritize for the community, the most in needs. And we focus for our families. Next, please. You can see this is all the organizational partnerships. We have a KFMC, Compass Health, Behavior Health, Walmart, City Housing Authority, National Beef, Food Bank, the church, the United Methodist Church, and Catholic Charities. So we work together to be successful in this. So we're here to make sure our family outside, they're fine and are good. Please help. Next. Our food pantry is always available to assist in case of any food insecurity emergency. We have to say thank you for all the partners, Compass, Behavior Health. We received donation from Walmart to keep our pantry really with food. Sometimes I'm gonna tell you guys, it's really hard when we have our pantry low because we don't want our family, come over here and ask for food and said, sorry, we don't have. But we find that resources. If we don't have a food, immediately I will call one of my other community health worker on KFAN, and we're trying to find the resources to help our families. Next, please. For many years, Genesis Family Health Clinic have this partnership with Compass Health, and I have to say thank you for Bobby. He's there in the picture. He always called me, Kareem, I have some food. You need it? Yes, sure, come. And he always come and he always happy to help. So this is possible because we're here for our community. So we really care about them. Next, please. This has made me really happy to say this. Long time ago, months ago, we went to Walmart and we see the store was really low, no food, and we have a really huge concern. And we have the director for the food bank, and we explained what happened, the situation. Immediately, they sent to us the bunches of boxes for food, and we can help 30 families. That was wonderful. I can express you guys how make me feel happy to help the families, and you can see the kids are happy with bags for food. That's really wonderful. Next, please. For the season for Thanksgiving season, we already have the church, the United Methodist Church. We have a board meeting with the pastors, and we express to them our concern for ready planning any food basket for the community. And the last time we talked to the pastor, and they immediately help us with 18 complete food basket for Thanksgiving dinner. And National Beef, they're the wonderful sponsor. We received 25 turkeys, so we have to help 25 families most in needs to have a wonderful Thanksgiving dinner. Next, please. You can see here the picture when they brought the turkeys. We have it's so beautiful to see the turkeys and the complete dinner for the family. So everybody can share the wonderful day to be thankful for be healthy. So this is a wonderful thing. We help 25 families. Okay, next, please. This is the second year we have the helping the South High Rise low-income apartment for food distribution. But for this year was a wonderful week because we have a partnership with KFMC, and they help us to get that and we can help 120 units for the residents. That was a really wonderful. Last year we did it, and this is the second year, and we want to get this traditional. And so I would like to make this happen every year. Next, please. And yes, we will always be here for our community. Our team always working hard to achieve the mission to help the more in needs. And this is happened because we have a wonderful other communities around the Fort County, and we're going to be here to make successful for the families and fulfill the missions. Next, please. And I'm going to say thank you. This has happened in 2023, and our pleasure to collaborate with the community and make that voice for that. The most that's going to, for us, is going to be essential to make this happen. And thank you. And I'm sorry, I'm so nervous. Thank you so much.
Well, thank you very much for that, Kareem. We absolutely love to see the engagement that community health workers are having with this issue at hand, and seeing people smile at the Thanksgiving dinners must have been a very nice treat. So at this point, we do have time for quite a bit of Q&A. For those of you who may have missed the message in the chat, we will be doing a Q&A session about the presentations, and then we have some discussion questions as well after the Q&A. So I noticed a couple of questions here in the chat. And this was from Melinda. So Melinda, you had a question about, Melinda Hagman had a question for Callie about the food prescription pay program. Does the grant money pay for the actual coupons? And are there any educational services that are billable through the clinic?
Yeah, so currently our grant does pay for those food coupons. We are actually applying for another grant and having conversations about sustainability. There are insurance programs that pay for other types of food prescription programs, so that's an avenue that we hope to kind of look through, as well as depending what nutrition services the participant is provided, billing could be a possibility. Right now at Kansa, our dietitian services are free to patients who have providers with us. So that's how we are kind of able to have our services embedded in the program.
There was also another question from Nadine, and for all presenters today, we see in media posts that many organizations will donate canned foods that require a can opener or fresh ingredients like milk, eggs, that require preparation. Is that something that any of your locations are able to address when handing out this food?
I can kind of highlight that a little bit. In addition to that, my mother happens to serve in a sandwich ministry here in the Topeka community, and they get bonus donations from multiple partners in the community, such as whole chickens. And my mother shared the story of a young man coming to the counter, and they asked, you know, do you want a chicken? Because they were trying to give away the chickens. And he looked at him and he said, a whole chicken, like raw? And they said, yes, it's a raw chicken. And he said, first off, I would have no idea what to do with a chicken. And number two, I don't think I have a pan that I could cook a chicken in. So those are the kinds of things that come up in their particular ministry when they're handing out their sandwiches every day. So, you know, how do you move people when they identify something like that? How do you move them to a solution to be able to use that food?
I can kind of answer this through like at Conza Prairie Community Health Center, we have a food pantry that got embedded along with after starting our prescription program. We have written for small grants to buy appliances like this to help. I've personally bought appliances like this, and we also have a donation site within Conza Prairie Community Health Center. So we check there first. Through using the Kansas Food Bank, we actually today got a big pot roast dropped off, and that's one concern that I have. Okay, now we need to make sure we are asking those questions. Do you have means to cook this? Do you know how to cook it? And as dietitians, we also write recipes to go along with how do you cook a pot roast or a whole turkey, whole chicken. So they are sent home with feeling confident with having a recipe available to them.
We invite anybody to raise your hand, to come off mute, or type into chat any questions that you might have for any of the presenters.
Hello.
I have, oh, go ahead, Victoria, sorry. Did you have a question, Victoria? I also have a note that Lucia Carrera might have something to ask or add to this particular part of our Q&A session. Lucia, if you could come off mute, that would be grand.
I think we've accidentally put everyone into a state of stunned silence. And I love Jill. I'm gonna butcher your last name. I'm so sorry about this. Dahati. I love your comment here to give out crock pots to be able to address the issue of cooking meals without a stove or a microwave or pots and pans. That's a fantastic idea. And crock pots are typically very safe for single room occupancies. Well, and I love, Lisa, that you've made a comment about all the brilliant ideas, which brings us to our next point, that we have some discussion questions for everyone to kind of chime in on. If you have ideas, you can drop them in the chat. If you want to respond to these questions, we'd love to hear from you. So, yes, Victoria Clote, I'm guessing your microphone went off. For those of you not looking at the chat, did Callie Brownlee state that the redemption rates were low for the program in Geary County? Yes, it is on her slides that the redemption rate is a little low. I think, Callie, you had mentioned that there was some sparseness with getting those turned in with their health visits. Could you elaborate more on that?
Yeah, so we see our redemption rate is about a little over 50%. And I think I haven't done a lot of the kind of data working, but typically during our farmers market season, we see a higher redemption rate. And kind of using those coupons, that's somewhere where people frequent often, buy other things that they need for their home. when they're using the food site just at our health center, we see that that redemption comes with when they have appointments here. And that's why it's so important for us to find other food sites. We either need to establish one in other places throughout our town or really create that partnership with our local grocers.
That is a fantastic idea. And I love that you are also engaging the corporate side of things with Walmart and Dillon's in your area. It seems like Ford County is having a lot of success on that side of things with getting some engagement on that. So that would be a perfect opportunity for some cross-county collaboration there to try and see if that's something that you can pull into the local area as well.
Great suggestion, Luca. I thought the same thing.
Yes, Lisa, this presentation has been recorded and we will make sure it is available to everyone after the presentation. And Tina Gunther has made a great suggestion of handing out can openers would be helpful as well, as it's an option of getting cans with a tab top instead of a can opening, having a can opener be required. But in all reality, having a can opener available to be donated in addition to those canned goods would actually be a fantastic idea. Jill Nelson said in Riley, there's a kitchen closet to address the needs of having pots and pans and baking sheets in a community college where students move and donate kitchen items. That is a fantastic idea. And that would be something very easy to establish in just about any location.
Well, and I would chime in that if someone is into dumpster diving, show up on a university or a college campus on move out day, and you will be absolutely stunned at the items that are thrown into dumpsters by college students leaving, and they don't want what their parents gave them, or they purchased secondhand to use in their dorm apartment or dorm room. So you could actually probably put together a community effort to dumpster dive on those days if someone was willing to do that, because you would be amazed at what gets thrown away by students at that point.
And I also love these wonderful ideas that are coming up in the chat, dropping a can opener when you donate personally. I do know that up here in Topeka, the Washburn students actually have a food pantry of their own. And so they can donate food to that food pantry for other students in need. I think they have a kitchen equipment section as well. And that's an interesting point to make sure that we're taking that into consideration.
Sarah's comment that you could place donation bins in dorms for routine collection is actually a very good one, because kids do just throw stuff away. They're not conscious to that. Great thoughts, people. So we do have some discussion questions on the board. The first one is, what are some best practices you have seen work? And I think we're getting some of those things in chat, but does someone else have something that they would like to share that is working in your community, or you've seen work in other communities? That can be, we have a mantra at KFMC to share openly and steal shamelessly, and this kind of fits into that mantra. So if there's something that you would like to share that's working well, that would be great. We have one actually in the chat now, that at the end of harvest, they comb fields for edible produce that was not picked up by the large machinery and bring it to the local food pantries. Anything else that people would like to share? The next question is, how do we ensure that everyone who has food insecurity is reached? And I think that's a big question in all of our heads and situations that we deal with. How do we make sure that that food insecurity is taken care of and reached? You know, people don't always want to share that they have that issue. I recently worked with a social worker that learned that she was brand new, learned that she couldn't, if she said, "How can I help you?" to the people that she was working with, they didn't answer. But if she said, these are some things that as the social worker for this organization, I can assist you with, then they might say, well, I really could use some help with food, or I could use some help with meal delivery, or I could use some help with transportation. So how do you guys overcome those challenges?
I love what Christine's put in the chat here, using social media platforms, especially when the social media is free and the food is free, to advertise that food is available and where you can pick it up for donation items. That is something that we think we all do, but I doubt we utilize it to its full potential to try and reach as many people as possible.
We have one about food bags provided to students during winter and spring breaks. I have a sister who was a teacher, and she told heartbreaking stories. She kept granola bars in her classroom so that she could slip them into kids' backpacks, because she knew the only meal they were going to get that day was whatever was served for lunch. And she could put a granola bar in their backpack without saying anything to anyone, and the other students didn't see that happen. So organizations are all starting to have to step up to a new requirement or condition of participation if they're a hospital, to make sure that they're assessing social determinants of health related to food insecurity and things like that. So part of that process is, if you ask those questions and you identify one of those needs, how are you addressing that need? And that's the piece that's not necessarily ready for most organizations to facilitate that. So what are your thoughts on how you're going to make sure that you meet those needs that are addressed? Lots of food for thought for questions. Diane, I like you kept food in the nurse's office for students. And college students are often in that food insecurity category. And young professionals.
I do like what Catherine's put in the chat here. Leading with community first language helps, makes it feel more like a social event rather than a handout. And I love that that's the type of small change that we can all make to kind of make this a little bit easier on folks.
Gathering resources is a challenge. My husband and I traveled to a small community for a weekend away recently, and they had it wasn't really a food pantry, but it kind of was. It was a building that had obviously sat vacant for a while, and they opened it up as a community sharing building. And it said, there was a sign out front that said, have one, bring it, or take one, leave one. And people were able to get food from this community building, as well as if they had a surplus of something, to leave that behind. And it was open 24 hours a day. It was free will donation, wasn't monitored. And people came and went. Every time we drove by it, there were people there.
It looks like, Diane, you've mentioned that one of your daughters is heading up a food drive at the local community college. And I love that you've already implemented the, hey, make a request for can openers to go with that, because that's going to be the important part of the access conversation. Is great. Well, now you have the food, but how do you access what's in the can? I think that's a great way of reminding ourselves that access works on every single level. Having the correct pans to cook things in, having the correct tools to get the food to where you need it to go. That's a fantastic thing to remember when we're talking about access as a problem.
And Chiquita, your comment about COVID and the difficulties in getting food to people who were in quarantine or at risk was a big challenge, and that you had a local group that delivered food. And I would challenge everyone on to think about, God forbid we go into a major pandemic situation like that again, but we do have to be better about making sure that we reach out to those people. How do we work with that type of situation while protecting the people who are volunteering and providing those things? How do we also continue those activities? Because many food kitchens and things just closed down. So how do we continue to provide to meet that need during a situation like that and plan for it?
And Christine Picard made a comment as well that there are a lot of people falling through the cracks that don't qualify for assistance, but still can't afford some basic necessities. And I love that you've included in here hygiene items and diapers as part of this discussion, because food in and of itself enables us to do things, but in all reality, it's one component of this missing issue that we're addressing. And bringing hygiene items into it is something that we really should consider doing, because it's a little bit easier to get donations of baby things, because everybody loves babies. And it's something that we can definitely incorporate when we're asking for donations or we're running programs of things.
Well, and Ashley shared that some restaurants have a pay what you can model. So how do we work to make sure we add that to a resource list that we're providing to people who do have insecurity? How do we make sure they're aware of that so that they can find that resource readily? Those are the kinds of things that we may not have on our resource lists.
And I love that we're mentioning the blessing boxes that are popping up around various small towns. It's like a miniature food pantry just right on the street corner. It much like what you described, Nadine. They are take and give what you can.
Mm-hmm. And they started, I think, with the book sharing concept where people put little libraries in a neighborhood, and they're using those same boxes, I think, for food now.
Well, Dawn, I like the idea of using unused hotel toiletries and delivering them to homeless shelters and other people in need. But I will admit, I misread your message and I thought it said you used a drone to deliver those things. I was very excited about that all of a sudden. But that is fantastic. So I do want to, in the acknowledgement that we are set to close out here in a couple of minutes, I want to make sure that everyone is aware that we have, in fact, compiled a list of resources for you all. All of these resources were used in the making of this presentation today. And if you would like any of the Feeding America data that I presented in the beginning part of this presentation, the email is right here so that you can also access that raw data. You're not looking at it through a filter that we've put it through. This is the entirety of the data that they've collected. And at this point, I do want us to revisit one very specific thing, and it's this graph right here. Now, we all know that we're doing the best we can to address these issues, but the concerning point that we need to remember is that the trend is not going in our favor. From 2020 to 2021, we had more people that fell into a state of food insecurity. And that could be because of the pandemic. That could be because of the recession, numerous other factors. But we have to continue the conversation like we're doing now and addressing these issues community by community in order to ensure that the change sticks. Because change doesn't have to be loud to be effective. It needs to be consistent. So with that being said, our emails are here on this slide. If you have any questions about the presentation, if you'd like to contact us, Nadine, I am very sorry, but it is Tammy's email up here as well.
That's okay. Reach out to Tammy.
We do have a wonderful survey for those of you who would give us your feedback. We have a QR code here on the screen, and Nadine has also just dropped it in the chat. I would love to continue the conversation with you all, and I'm looking forward to seeing our partners at our next meeting here in February as we decide on the next topic for this series. So please keep your eyes and ears on your LinkedIn pages and other social medias for the next iteration of the webinar.
And I would chime in. Thank you for joining today. This content and topic was identified by you. We want to make sure we bring relevant information to you all, and maybe hopefully Tammy will be here for the next one. But Luca did a
Hopefully.
fine job of picking up when I wasn't sure where I was supposed to go. So thank you all for attending.
Thank you all for participating as well.
And we will share the slides with you.
Yes.